All right, and good afternoon. Welcome to the San Francisco Bay Regional Water Board's public meeting on indoor air quality at the Camelia Properties in Berkeley. I'm Molly Williams. I'm an environmental scientist with the State Water Board's Office of Public Participation, and I will be facilitating our meeting today. And I'm going to go ahead and pass it to the other state agency representatives who are here to introduce themselves. Amanda, you can start, or Emma, you can start.
Okay. My name is Emma. I'm with the State Water Board with the San Francisco region, and I'm an engineering geologist. I'm also the case manager for this site.
And hi, my name's Ron Gullabell. I'm also an engineering geologist at the Regional Water Board. I'm Emma's supervisor, and together we are working on this project moving forward.
And hi, my name's Amanda Palumbo, and I'm a toxicologist for the Office of Environmental Health Hazard Assessment, and that's part of the California Environmental Protection Agency.
Great, thanks everyone. And before we get started, I just wanted to give everyone a reminder that this meeting today is between us, who are representatives of state agencies, and you, who are members of the public who we serve. And we'll do our best today to answer any questions you may have that pertain to technical aspects of the project, such as site cleanup or health impacts of PCE. And if you have any other questions that are relevant for the property owner, we encourage you to reach out to them directly. All right, so here's our agenda for today. We'll take a moment to cover Zoom logistics, and then Emma will present on the history of the Camelia property site, as well as give an overview of the current situation and status. We'll then have time for questions and answers on this topic, followed by Amanda's presentation on PCE and potential health risks. We'll then have time for more questions, and we'll adjourn by 2 p.m. at the latest. And just as a reminder, we're also holding this same meeting, presenting the same information this evening at 6 p.m. For anyone that you know who might not be able to join but would like to have access to this information. All right, so please just take a moment to make sure that your name is correct in the participants list. You can go ahead and rename yourself if it's incorrect. Looks like we have a couple folks here who might not have their full name there, just so we can get a sense of who's with us today. And when we have time for questions and answers, we'd like to keep speakers in order by having folks use the raise hand function. So down at the bottom bar of your screen, you'll see a button that says raise hand. That will indicate that you want to speak, and then we can invite you to unmute yourself. And if you're calling in on the phone today, you can press *9 on your keypad to raise your hand, and then *6 to unmute once you are called upon. We also have the chat function enabled, where you can ask questions or provide comment, and we will be monitoring that as well. And last couple things, the meeting's being recorded today. We're going to post it on YouTube after the meetings today and email out that link to folks. And if you would like to turn on closed captioning, there's also a button that says live transcript on the Zoom utility bar there at the bottom. And you can turn on closed captioning and have captions available for you. All righty. I'm now going to pass it to Emma to give a historical overview of the situation.
All right. So this is just a recap of site history. I know some of you might already be familiar with it, so I apologize for any repetition. So the site started off as a Canada Dry bottling plant in 1940 through the late 70s. At this time, PERCSERV occupied the property. The name PERCSERV, with PERC being an abbreviation for perchloroethylene, which is another name for PCE, which probably sounds familiar to some of you since this is the contaminant of concern at the site. So PERCSERV stored and distributed PCE for dry cleaning operations, and it's believed that during this time, PCE was accidentally spilled at the property, with the source of the spill located at the current loading dock on the western side of the property along 9th Street. In a few slides, I will be showing a map of where this is located. So in the mid-'80s, the building was renovated to its current use as retail spaces, office spaces, and a warehouse. And then in 1999, just to provide some context on what occurred the following year in 2000, the property owner refinanced the property, and during that time, an environmental assessment was completed, and it was determined that PCE had been spilled. So after that, in 2000, the site officially became a cleanup site, and groundwater and soil sampling commenced. Next slide. After this point, groundwater and soil investigation continues. 4 indoor air samples were taken at this time, and around 2010, a corrective action plan for groundwater was proposed. So after several years of investigation, the relative area of the PCE source was pinpointed, and groundwater injections were proposed in an effort to treat the PCE. After doing these injections, continued monitoring was conducted to evaluate the effectiveness of these injections. And this process can take up to several years sometimes to allow the chemical reactions to occur as a result of this remediation method in groundwater remediation. Next slide. All right, so 2015 was a very important year, not just in the timeline of this project, but in the timeline of many of our sites in the site cleanup program. DTSC released the 2015 Soil Gas Sampling Advisory. So soil gas sampling became an industry standard at this point, and also right around this time, the first indoor air environmental screening limits were put into place. And the science on vapor intrusion is constantly changing. And even as of 2019, just a couple of years ago, our agency put out a new vapor intrusion guidance document with even more information about how vapor can migrate into indoor air, and had even further reduced indoor air screening limits from the previous guidance. And really since 2019, the focus on site cleanup has shifted from mostly just being a groundwater problem to also putting a large focus and a priority on potential for vapor intrusion to indoor air. And now at most of our cleanup sites, the focus during the investigation phase has really been on whether or not a site could have potential indoor air issues, since we now know that indoor air issues signify a completed pathway of exposure. So after this information was released, soil gas sampling was conducted at the site, and the results did indicate that vapor intrusion could potentially be occurring in the building. And around this time, an excavation around the loading dock to remove the contaminated soil was also proposed. And in order to find some funding for the vapor investigation, which was outside of the original scope of the site cleanup, since it was previously just a groundwater investigation, the property owner needed to obtain some funds. So in 2018 to 2019, they applied for and received a SCAP grant. SCAP stands for Site Cleanup Subaccount Program. It's essentially a government grant that allots a certain amount of money for investigation and cleanup. And then indoor air monitoring began in 2020. It was determined that vapor intrusion was occurring inside of the building. Next slide. All right, so this is an image depicting how vapor intrusion works and how it can migrate into a building. So at the bottom, you can see the contaminated groundwater in blue, and there's a large black arrow pointing up, denoting how the vapor travels through the soil, and it can be trapped under the foundation slab of a building. So while this air is trapped beneath the building, any cracks in the floor can allow this air to migrate into the building. And any open drains that lead into the building can also act as a pathway for this air. Next slide. As a response action to the vapor intrusion that is occurring, a survey of cracks and open floor drains were conducted in the building in 2021, and again recently in 2022. Any cracks and open floor drains were sealed. Periodic indoor air monitoring and reporting was also conducted beginning in June of 2021 and ongoing. Fact sheets are also provided to the tenants, alerting them of the vapor intrusion. Air filters were installed in the tenant spaces, as well as large industrial ceiling fans were installed as part of a response action to the indoor air quality data in November of 2021. At this time, the owner and their consultant submitted a comprehensive vapor intrusion mitigation plan. Unfortunately, this was too expensive to fit into the grant budget, so a revised and more cost-effective version was submitted and recently approved by the Water Board. And the property owner also applied for an excavation permit from the City of Berkeley Planning Department back in July of 2021 in order to be able to excavate the contaminated soil from the property. For those of you who have been following our fact sheets, you know it's been a long process to obtain this permit, and I can finally say the excavation permit has been approved and is being issued this week. Next slide. Okay, so this is a map of our latest April 2022 indoor air sampling data. I recognize the image is small. So right now I am putting a link to that in the chat. Let me just enter that so that you can follow along. Let's see here. Okay, I just put that link in there. Okay. All right, so just to orient everyone, Camelia Street is at the bottom of this map, 10th Street is on the right, 9th Street is on the left, and we're looking down at an aerial view of the building layout. All the yellow circles are sampling probes in the tenant spaces, and the green boxes contain the values of the indoor air sampling results for each sampling probe. The highest concentrations as of April 2022 is 130 micrograms per meters cubed in the New Age Meats space on the left near the loading dock. New Age Meats has always had the highest concentration of PCE in indoor air at the property. The space initially had 310 micrograms per meters cubed of PCE in indoor air prior to installing the industrial fans. After this, the value dropped to around 200, and then there was a large crack also present near the sampling probe, which was very recently filled, and it seemed to have a big effect on the indoor air data in that space, with the air data now at 130. Concentrations have decreased across the board since implementing these mitigation measures. Next slide. All right, so in terms of current site activities, as I mentioned earlier, the excavation permit is being issued to the property owner this week. And for vapor mitigation that is ongoing, the pilot test process for the vapor mitigation system at the building began a couple of weeks ago. The pilot test itself begins this week. And to explain how the process works and what the test entails, I have a map coming up. Next slide. So before I point out some of the features on this map, I'm going to give a brief explanation of what the vapor mitigation system entails and what this pilot test is. So as explained earlier, vapor that is released from contaminated groundwater migrates through the soil and can be trapped beneath the foundation slab of a building, with certain pathways allowing the vapor to enter the building. This vapor mitigation system will essentially act as a vacuum cleaner with a variety of small vacuum points spread out beneath the building slab, sucking out this contaminated air that's beneath the building, treating it and discharging clean air to the atmosphere. So this map that has the same orientation as the previous one I showed with Camelia Street on the south side, 10th Street on the right, and 9th Street on the left, and our view being an aerial view overlooking the footprint of the building. The circles are where all the little vacuums technically are going to be located. All the triangles are sampling ports where samples will be taken at the end of the 30-day pilot test to evaluate its effectiveness. The pilot test is needed because we want to make sure that the vacuums are in the right place, that there are enough of them to reduce the concentrations of PC in indoor air. And if the pilot test is successful, the data from that will be used to design a more permanent vapor mitigation system. Next slide. So this is a more zoomed in version, and this is to show you primarily where the proposed excavation will be occurring. So where the star is located at the left of the building along 9th Street, this is where the current loading dock of the building is. This dock will be removed and the soil beneath it and around it will be excavated. And this, in theory, should help reduce the concentrations in the tenant spaces immediately located near the loading dock. Next slide. Our next steps are to complete the soil excavation, install a more permanent vapor mitigation system, assuming the pilot test is completed successfully, continue to monitor the contaminant concentrations at the site and continue to issue fact sheets with site updates, and also conduct additional groundwater investigation at the site and off property and remediation of that groundwater as needed. Next slide. Okay, so that's it for me. Now we will be moving on to Amanda's presentation.
Did we want to break for questions or?
I think we might just do questions at the end for the sake of continuity.
Okay, sure, I can go ahead.
Yeah, let's go ahead and move on with Amanda's presentation.
Okay, so again, my name is Amanda Palumbo and I'm a toxicologist. I work for the Office of Environmental Health Hazard Assessment. which is a sister agency to the water boards within the California Environmental Protection Agency. So I'm going to be talking about PCE and its potential health risks at the Camelia Street properties. So next slide. So what is PCE? So PCE stands for tetrachloroethylene or perchloroethylene. It's a solvent that's commonly used to dry clean clothes. So although PCE will actually be phased out of dry cleaning operations next year in California due to the health and environmental concerns. PCE is also present in consumer products such as adhesives, stain removers, and automotive cleaners. So you can see more details at this website, what'sinproducts.com. And an important characteristic of PCE is that it evaporates easily. In other words, it's a volatile chemical. So this means if it's in the soil under your building or in product containers in your home that aren't sealed, the vapors can contaminate the indoor air in your building or your home. Next slide. So now I'm going to describe the health effects. So the levels of PCE at the Camelia Street properties are relatively low. So the concern here is for long-term low-level exposures. So that's chronic exposures. I have listed on the slide potential health effects of PCE. These are from the Agency for Toxic Substances and Disease Registry, which is part of the CDC, the Center for Disease Control and Prevention. So PCE can potentially increase the risk of certain cancers, such as bladder cancer, non-Hodgkin's lymphoma, and multiple myeloma. There are also other health effects other than cancer, which we call non-cancer health effects. And so there's some that affect the nervous system, and these include changes in mood, memory, attention, reaction time, and vision. And also PCE can harm the liver, kidneys, and the reproductive system. And I should say some of this information is based on animal studies, but some of it's also from evidence in studies of people. Next slide. So state regulators use screening levels to assess the health risks at properties like Camelia Street. Screening levels are concentrations in air that should not pose harm to the population, including sensitive groups such as children, pregnant women, and those with health issues over the long term. The screening levels include several protective factors, so they are designed to be very health protective. And so the screening levels for PCE in air are 2 micrograms per cubic meter of air to protect against cancer, and 180 to protect against the other effects other than cancer or the non-cancer health effects. So the levels of PCE at Camelia Street were measured at between 4 and 310. So some of these levels are higher than the screening levels, and that indicates a potential health risk. Next slide. So we have some exposures above screening levels. So now I'm going to try to give you a sense of how likely it is that health effects might result from exposures to PCE at Camelia Street. I want to make clear first that there is no certainty that anyone's health will be affected when concentrations are over screening level. This is an indication that there is a chance of health risks. So we describe the risks for cancer and then the other non-cancer health effects differently. So I'm going to start by talking about cancer. For cancer, we can describe the health risk with a numeric probability. So for example, the screening level is set at a cancer risk of 1 in a million, meaning there's one chance out of a million a person would develop cancer from exposure to that level of PCE. So that's a very small risk. If the risk is smaller than that, U.S. Environmental Protection Agency guidance says it's so small that it's insignificant. At Camelia Street, the levels of PCE were different in the different units in the building. So there's 20 different tenant spaces. And so I calculated the cancer risks for the high and the low concentration. And those cancer risks range from 1 in 700,000 to a risk of 1 in 6,000. And these calculations assume 25 years of exposure for 8 hours per day. So if you're not exposed to that, if you're not there that long, the risk is lower. So to put this risk in context, we can compare that risk to the lifetime risk for the general US population for developing the specific cancers using data from the American Cancer Society. For example, the general population risk for bladder cancer in men is a 1 in 27 chance. And for multiple myeloma, the chance that the average person will develop that cancer in their lifetime is 1 out of 132. So these risks are higher than the risk estimates for Camelia Street. So I'm not trying to say that the risks and the PCE at Camelia Street is okay. I'm just trying to put this information in context for you. So next slide. Okay, so for the non-cancer health effects, we can't quantify it, the health risk. We can't put a number to it like we can for cancer. So to try to put this in perspective, I put some values in the table we can compare. So first in the table is the screening level of 180. So remember, that's the concentration that should cause no harm. And second, I have the maximum concentration that was measured in one of the units at Camelia Street, and that's 310. And third, I have the concentration in which effects were observed in people who use PCE in their job, and that's 56,000. And that value is actually the basis of the screening level. So while the maximum measured level in air at Camelia Street is above the screening level, it's actually fairly close to the screening level in comparison to the concentration that effects were observed at. In other words, 310 is a lot closer to 180 than 56,000. So this tells us that the chance of effects from exposures to the maximum concentration of 310 is pretty low. And actually, most units in Camelia Street had concentrations below 180, so below the screening level. So that indicates no chance of the non-cancer health effects in those units. Next slide. So in summary, PCE is used in dry cleaning and commercial products. PCE can cause harmful health effects. The PCE levels are above the cancer and non-cancer screening levels in some units for the Camelia Street buildings. So there is a risk of health effects, but it is relatively low. And I say that because the screening levels are designed to be very health protective. So that's all I've got. So we can move to questions. I mean, questions for me or questions for Emma or anyone else.
Great, thank you, Amanda. Thank you, Emma. So we're going to go ahead and open up the floor to any participants who are here today who would like to ask a question. And once again, you are invited to use the raise hand button down at the bottom so that we can get a sense of our speaking order today. And then after that, I'll invite you to unmute yourself. So it looks like Chip Gribble has a question, so we'll go ahead and ask you to unmute yourself.
Yeah, hi, thanks. I'm sorry, could you repeat your name again, the toxicologist? I didn't get that.
Amanda.
Amanda. Yeah, thanks. So I think you've got it wrong, quite frankly. I think you're talking about, you're misinterpreting what your assessment is for future risk, not for current risk, not for past risk. And you are also not acknowledging the highly variability, spatial variability, temporal variability of that data or your characterization.
So the health risks I presented are based on the concentrations that were measured in the last 2 years. I used the maximum measured concentration. So yeah, it does assume that that is a representative concentration for 25 years of exposure for 8 hours a day. And those are some assumptions, but I think that's a fair assessment.
Right, it's a fair assessment if you are talking about going forward for a future risk, but it does not speak to the people who have been working in that building and been frequenting that building in the past. So if you're talking about a cleanup, guiding a cleanup and working toward a decision on remediation, you're on target, and that's conservative and appropriate. But there is a contingent of people here who have been in that building, spent a lot of time there, some of whom have experienced some health effects, and that your assessment does not speak to their situation.
So at this point, we don't have other information to suggest that concentrations were higher in the past. I know you can speculate that, and it's a logical question to ask. I totally understand that. But at this point, this is the best estimate we have of the exposure concentrations.
I get that, but you should also acknowledge the quality of your, or the representativeness of your data set for whatever. In other words, this temporal and spatial variability. And there's no control. We all know that when you're doing these kinds of contamination situations, there is very little control or no control over the ventilation, the temporal and variability changes in where that canister sits for 24 hours. If somebody comes in and opens the door, you've got to change. If somebody opens a window, you've got to change. If somebody turns on the fan, you have a change. If somebody comes in at night and ventilates the building to artificially lower the data, you have no control over that. So it's a very squishy thing if you're talking about people who have been in that building and their issues. If you're talking about remediation and coming up with a determination about an appropriate remedy and whether it's safe for future use, you're on target.
Okay. Yeah, I mean, there are uncertainties, but yeah, I think you've made your point. So maybe we can go to the next one. Yeah.
Thanks.
Yeah, and just as a reminder here, we'd like to limit the crosstalk that happens just so that we have enough time for everyone to ask their questions. So if you want to, when you ask your question or give your comment, kind of include everything that you would like to say up front, and then we can respond and then move to the next person. That works for everyone. Okay, Laura Mangles, you are up next. I will go ahead and ask you to unmute yourself.
Hi, can you hear me?
Yes.
Yes.
Great. Yeah, I have so many things that I want to say, but I'll just share that I'm coming from a doctor's appointment at UCSF at their toxicology clinic. And I just met with the top doctor who started the toxicology clinic. And I have to tell you that his opinion about my health risk seems to be very different from what is being presented here. I'm not going to get into details on that. I just want to state that for the community to be aware. I also wanted to give some background information on who Chip Gribble is, because he did not introduce himself, and I think it's highly relevant to know that Chip Gribble was a very senior person in the DTSC, the department that deals with toxic cleanups, and he himself has overseen the cleanup of various toxic projects, including major ones. And so his opinion is actually very expert, and he is not speculating at all when he explains that there actually is a severe data problem. And he's being quite mild about it. But what I understand, having had many conversations with him, is that the conditions that would generate high concentrations of the vapors are the conditions that were actually not present when you did the measurements. Because my understanding is that COVID conditions with fans going really changes the levels of measurements that you'll receive. And also there's a weather factor. My understanding is that the groundwater is a key factor here. And when you took the measurements, the weather was actually much drier than when I was working at the gym years ago, when I got really sick. So that's not really a question, but I guess my question, yes, I do have a question. My question is, what do you have to say about acute exposure? Because there's a lot of talk about long-term exposure, and clearly that is something to be concerned about. But I believe that I'm experiencing acute exposure, which makes me believe that it's possible that the concentrations were a lot higher than what you're now measuring, which would not be surprising considering the low quality data that you now have in terms of how it generalizes to prior conditions. So I guess my question is, what kind of thinking have you done about acute exposure? And are you at all concerned that there are several people who believe now that they are suffering the symptoms of acute exposure? Thank you.
So I can start, and then maybe Emma, you can follow up with the data quality. Of course, if people are suffering symptoms, it's a concern, right? But I did look, the acute threshold for PCE that was developed by OEHA is 20,000. I guess it's possible that somehow concentrations were higher than that, but it seems to me really speculative and unlikely that that was achieved. Anyway, yeah, so that's the acute threshold. It's what is it, 100 times higher than what we've seen in there so far. So that's a pretty big difference.
So I can speak on a little bit of the data collection. So yeah, you're totally right, Laura, in that, you know, opening a door here can cause the amounts to fluctuate. Seasonally, the amounts fluctuate. So that's why, you know, we've done multiple indoor air sampling events since 2020 to try and capture the average of some of this. Of course, you know, in a perfect world, we would travel back in time with the information we have now and do sampling prior to 2020. So it is unfortunate we don't have that data, but all we can do now is, you know, use the data we do have to figure out ways to mitigate this so that more exposures don't happen in the future. Oh, also, just for context, I realized Ron and I didn't mention, we are relatively new to the project team. We came on a few months ago. So just a clarification on that.
Great. Thanks to you both.
And yeah, I'll chime in a little bit on the past. I mean, it's just, you know, we have one data point from 2002, and then, you know, so and any other data point would be highly speculative to try and figure out whether it was higher or lower. But you know, we're just trying to deal with the data set we have now, and clearly, you know, turning on fans and closing doors can, well, it could go both ways. It could go higher, it could go lower if you seal up a room. So, right, we're just trying to focus on the current condition. It's just very difficult and speculative to go back in time without the data.
Right. Sounds like we're trying to do the best we can given the information that we have access to and the sampling that we've been able to do. Okay. Laura, did you want to quickly respond?
Hi, can you hear me?
Yes.
Yeah, thank you. Yeah, I guess one thing that I'd like to just mention is that these guidelines that you refer to are for workers who know that they're being exposed to chemicals. So the assumption there is that they use protective equipment. And also the assumption is that they work 8-hour workdays. And another assumption is that they're the typical male healthy worker. And, you know, we've had a lot of different people in our gym. Some have serious health issues. We've had pregnant people in our gym. We've had little infants. So I'm not really sure how those numbers that you're referring to really track with, you know, the population that's actually being exposed. So that's one point. And then the other point I'd like to make is I very much understand and appreciate the position that you're in. In my opinion, as the water board, you are doing your job, which is to assess a potential health risk for the future. And you are going to make the landlord clean up properly. And you're going to make sure that this doesn't happen in the future, that we're going to have unsafe chemicals. So thank you for doing your job. I really appreciate it. Now, the one thing, if I could offer one little piece of criticism, if I may, I'm very frustrated that the water board keeps representing the health risk as minimal, because the reality is that you do not know, nor do you have the standing to know, nor do you have the data to know what the exposures actually were. So I would just, and honestly, that's not the goal of the water board, as you've said yourself. You're not into forensic investigations into the past. This is really about the future. So I would just ask, if you could, to please just be transparent with the community about your role in this entire situation, and not give the false impression that the water board is actually tasked with assessing health impacts, because that is not your job, and it shouldn't be your job. But I would also hope that you wouldn't take this position that you seem to be taking of trying to inform the public that there is low risk. Because my conversations with Chip Gerbil, who, again, I want to remind you, is an nuclear waste sites. So he really knows his stuff. So I really take him seriously when he tells me that exposure levels really could have been 100 times higher than what you're showing in your measurements. And I'm a little bit disturbed that for whatever reason, the water board doesn't quite want to acknowledge that to the public and just admit that when it comes to health impacts, that's not really your wheelhouse. And I really appreciate what you're doing, and I appreciate that you're going to make this a safe site for the future. But I really hope that we can just acknowledge that the health situation is very unclear at the moment. Thank you.
Yeah, so I do want to kind of respond briefly to the water board's role. Ron and I have been asked a lot of health questions, and we have been telling people that, you know, we're just geologists. You know, we're brought in to mitigate the problem. And that's why we brought Amanda in, the toxicologist, because, you know, this is her wheelhouse and she's familiar with the health effects of PCE. And Ron and I aren't equipped to make those, you know, risk calculations or determinations. So Ron and I have been, you know, prohibiting from telling people, you know, oh, you're fine, or no, you're not, because that's not our area of expertise. But yeah, Laura, I definitely agree with you on that. That is not in the water board's wheelhouse.
So, and I just wanted to clarify that the health risk thresholds are not the thresholds you were referring to, Laura. So you were referring to OSHA's, the Occupational Safety and Health Administration's health thresholds for chemicals, which are based on people knowing they're being exposed. It is based on healthy workers. It is based on people wearing and using PPE. These are not the numbers we're using. We are using numbers specifically designed for contaminated sites that are, look at the general population. OEHA includes factors to protect children. When the numbers are derived, they are uncertainty factors applied that account for the variation in the human population, because we know that the screening level was derived based on, yes, men working in, or at least adults working in dry cleaners. And we want these numbers to protect children and people with health conditions and the elderly and everybody. So there's uncertainty factors applied to them to make these numbers a lot more protective. So that's why the number from the study was 56,000, but the number that we're actually saying is a protective number is 180. So we've made that number quite a bit more protective to protect the general population. And OEHA thinks these numbers are wholly protective of everybody in the population. So I just wanted to make that clear.
Okay, Laura, did you want to just close this out?
Yeah, if I may, just really quick, and I'm, you know, I'm hesitating to make this comment because normally I don't like to say this kind of thing, but I feel like this is in the interest of the public, so I'm going to say it anyways. I understand that Amanda is being presented to us as an expert in the, and you described it as her wheelhouse, but I just want people who are on this call to know that when she was approached, question was, can exposure to general neuralgia? She said no. Now I invite you to take a look at the CDC fact sheet on PCE, because that is very fact sheet. So I just, that this is the person who's being presented to us. You know, later she received, you know, a paper, the link, and she's, information to give the public about health.
So a lot of that was broken up, but I think I know what you're talking about. And you're saying that somebody asked me about a nerve condition, and I was asked about a couple, so I don't know which one it was, but I believe that I supported that person's thoughts about how PCE can affect the nervous system. And I tried to find information to support that. And I sent that person the information I found that actually supported that PCE can cause those health effects. So I don't think I ever said PCE cannot cause those health effects. That's not what I told, and it was a one-on-one conversation. So I'm sorry that the person interpreted it differently than I did, but that was not what I was saying.
Yeah, and I just want to clarify that Amanda is an expert in this. She's not just being presented, and she's not part of the water board. She's part of a different agency. So just to make that clear. Okay, let's go on to Jennifer from Sanctuary Bistro.
Curious, it sounds like that in 2000, there was a known contaminant. What was the requirement for the people coming into that site to, like, I never heard of it until just yesterday. So how is it we went from 2000 to 2022 without any type of notification? So I wasn't even a tenant yet. So I feel like as somebody who was coming in, that, I mean, are there any legal requirements that somebody has to tell you that you're in a contaminated site or moving into a contaminated area?
Sure, I can speak to that. So usually there is not a requirement for the property owner to disclose that information unless the numbers are high enough to where the water board would require that. So after the indoor air was found to be above 180 in some of the spaces, the water board required the property owner thereafter to notify any new tenants moving in about their potential exposure if they were to be in that space. So back in 2000, there was no such requirement. It really just kind of is up to the property owner's discretion if they want to say something about contamination. I will also add that while there was indoor air data taken in 2002, there were no indoor air screening levels to compare them to. So while they did have data from that time, it wasn't sure, there was no meaning to what those numbers meant, and there's nothing to compare it to.
We did an evaluation recently of whether this would qualify for a Prop 65 notice. And it, according to the toxicologist we were working with, it did not qualify for that level of disclosure. So that's where the water board has taken upon itself to issue these fact sheets. Granted, it's, we're talking about 2020 now, and our outreach as we're constantly looking to improve how we do our public participation. So I guess that's, how we're handling it now through fact sheets and going back, we did get we're working on a list of previous tenants to inform them of the situation. And it's, a work in progress as we go forward.
Okay, it looks like Jennifer would like to quickly respond.
Just wondering, you said it is a requirement now. When did that requirement come into place? I
believe that was in fall of 2021 that the water board issued that letter.
Okay, we're ready to move on. Peter Warhaftig had his hand up next, so we'll go ahead and go to him.
Hello, hi, thank you. A couple of questions I have. What has the state water board done to ensure that the responsible party, which is the MFA entity that actually was the operator of PerkServe and the landlord, all the same family, are contributing enough of its own funds towards the cleanup?
Yeah, so they actually are paying for the new vapor intrusion pilot test that's happening. They had a more comprehensive, expensive one planned, but the grant wouldn't cover the full cost. And my supervisor and I went back and forth for the first few months of our time on the project, trying to obtain some grant funding for that. And then, you know, we ended up requiring the property owner to step up and pay out of pocket for that.
And is that a significant expense?
Yes, it can. Vapor mitigation systems can cost millions of dollars, depending on how comprehensive. I don't think this one is anywhere near that expensive because it is a scaled down version of what they initially proposed. But I'm not too familiar with the cost. The environmental consultant would know more about the pricing.
I see. Thank you. And related to that, can you outline how the SCAP funds have been spent?
Yeah, so I believe the initial grant was about $1 million total. And a significant portion of that spending does go towards periodic sampling events. It's expensive to rent the equipment and to mobilize the staff to collect those samples. I know a certain portion of the budget goes towards regulatory oversight. I know there's a large portion set aside for the proposed excavation because the permit from City of Berkeley can also be very expensive, maybe up to $50,000 because they have all their staff reviewing it over the course of, I guess it's been almost a year now. And so yeah, the excavation costs a lot of money. There was money set aside to install industrial fans in some of the tenant spaces. So yeah, there is the grant is on GeoTracker and it does have like the specific cost breakdown. I can look for that and put it in the chat so that you guys can see kind of how the money is allocated. And this is also an older grant. So the grant came about in 2019. And that was before we knew the extent of the indoor air intrusion happening. We knew it was occurring, but it wasn't until that first sampling round that we knew the values of that. So not enough money was allocated for as much vapor mitigation as we would like now. But we do have the opportunity in the future to do a revised grant, and we can add way more money to that scope of the project. So we're hoping to add more funds to that soon.
So, and Peter, really, the water board doesn't take into consideration the cost in some respects. We're looking more for the result of an action that would be put into play as opposed to the financing of it. This particular project, because it has a grant, has some financial aspect to it, but in general, we're focused on the results of an action as opposed to the cost of it.
Okay. So going to the results of the action, you know, does the State Water Board have requirements that the ventilation and filtration efforts that many of the tenants have taken on their own are adequate, and how will that be paid for?
So so the water board doesn't, you know, we're not sure what individual tenants have done. We only know what we've required of the property owner. So if you have any, you know, questions about payment or reimbursement for those measures, I would direct that to the property owner.
Going to that, this is my final question. The property owner, are there requirements by the water board that there be adequate communication, two-way communication between the landlord and the tenants?
Sorry, what was the question?
Does a water board require that the landlords respond to communication requests from the tenants?
No, so the only requirement the property owner has right now is to tell any new tenants or prospective tenants in the building about their potential exposure to indoor air.
But there's no requirement to communicate anything to the present tenants?
Correct, I believe
At
so.
this point, we do not have a formal communication plan in place. Peter, we could take that into account, but in general, we're somewhat taking it upon ourselves to issue the fact sheets out to the people we know about that are there, and as we accumulate the past tenants, but you know, talking directly with the owner, I would encourage that.
but there's no requirement by the water board that the owner actually respond.
Correct.
That is
Not formally, no.
formally or informally. Thank you. Thank you very much.
All right.
Thank you, Peter. Margot Schuler, you're next in line to speak. You should get a notification.
Thank you very much. Thanks for the meeting. This is informative. I am both engaged and involved in the childcare, one of the two childcare centers immediately across the street from this facility. And in addition, I am a neighbor 2 blocks away. I did not receive notification as a neighbor because I'm 1,000 feet away, and your judgment is that I'm not impacted. I do have a question. Most of the commentary and most of the discussion so far has been fairly generic, number one, about existing levels, but number two, so I'd like to hear a little bit more about exactly what the treatment plan does look like, since you've made reference to the fact that it is not what you had proposed in 2021. It's been modified. But two, what are the impacts to the outdoor air of all the venting and systems to help improve the air to the existing tenants inside the building? What's the impact on the adjacent community, and how are you monitoring that and communicating that?
Yeah.
My two questions. What's actually the plan, and what are you doing to monitor the outdoor air? Thank you.
Sure. So I can talk towards the plan, and then I'm going to spin that next part to my supervisor. So our treatment plan, the only way that it was modified is that there's just, I guess, less vacuum points. You know, ideally we'd have them just everywhere, but that's extremely expensive. So the scaled down version, primarily, you know, the ones they wanted before were horizontal vacuum points beneath the floor of the building. Now we're focused more on vertical points because those are a little bit cheaper. And I guess really the only way our treatment plan has modified since in 2021, just the excavation was really proposed. And then the vapor plan was proposed, but the excavation was kind of what we were going to do more immediately. And then when Ron and I came on the team, we kind of made the executive decision that vapor mitigation was needed now, as well as the excavation. So that's, you know, kind of how the plan has changed. We've prioritized the mitigation system, you know, now versus later. And I think there's anything else I want to add to that. Yeah, just kind of scaling down that initial proposed mitigation plan. And yet the pilot test will tell us if we need more vacuum points. If, you know, we're not getting as much suction as we want, we'll probably add some more vacuum points. And so our test data is really going to help us figure out what we want to include in our permanent vapor mitigation system and kind of where the points should be located. So that will help inform our decision.
Yeah, I'll pile on a little bit here. So the owner did do a previous pilot test with a shop vac that did show some influences underneath the building in terms of moving air successfully. And this particular plan that you see in front of you kind of builds on that with 3 horizontal points and 5 or 6 locations inside the footprint of the building. And so once we get that information together, we'll figure out the final spacing of the extraction points, planning to use the existing ones that are installed now. And if we need to augment it with more, that can be accomplished. So we're feeling good about our proposed plan to come up with a design for the final system. So that was kind of the spirit of the pilot test, which is, my understanding, is starting this week and probably towards the end of this week. In terms of air quality in the neighborhood, when the indoor air samples are collected on a somewhat monthly basis, in the past, there is an outdoor air sample collected as well. And there is an opportunity to check the indoor, or excuse me, the ambient air, if you will, through the exhaust fans and air filters that are operating now. This particular system, the vapor mitigation system that'll be drawing higher contaminated air out from underneath the building, will be treated through a carbon absorption system prior to being discharged to atmosphere. The final system, and even this temporary system, is permitted through the Bay Area Air Quality Management District, and they take a look at the amount of carbon that's being used, the airflow, the concentrations of the vapors coming through the carbon to ensure that it's being remediated, the air is not just being directly discharged to atmosphere without treatment. There's also periodic monitoring of that discharge while the system's operating. So let me know, Margo, if that answers your question.
Do you have that? Thank you. That's very helpful. Do you have what the discharge goal is for that discharge air? What's the concentration at the point of discharge?
I don't have that number in front of me. I can get it, but I know it's if it's not below reporting limits, it's low. The Bay Area Air Quality Management District has their guidance, and I can get that to you offline.
Great. I'd like to see that. Thank you. And that's helpful. Thank you.
Ron, did you have anything else to add there? Ready to move on? Looks like Phoenix Jim has their hand up. If you want to unmute yourself.
Hi. Yeah, I think this has been touched on a little bit, but I wanted to kind of make sure I'm clear on this. So as far as the notification of the spill and the air vapor, or even before the air vapor measurements in 2020, the water board didn't notify any tenants or have any requirement to notify any tenants of the possible issues with exposure? I just want to make sure I understand.
Yeah, so Ron, you might know a little more about this than I do because you wrote the water report then and I wasn't, but yeah, it's my understanding that there's, actually, Ron, why don't you take this one?
Yeah, no, that's fine. So at the water board, we're striving to do public participation throughout these projects. And typically when we're dealing with groundwater and soil, there's less exposure, if you will, because people are not drinking the water. In the evolution of vapor intrusion issues, we've increased our public participation, both need and ability. And so I think you're seeing that now through the fact sheets, whether you find it adequate or not. That's how we communicate. And in this particular endeavor, we've engaged our Office of Public Participation, which has provided us, Molly here to help out as well. And we have other folks at the Office of Public Participation, for translation services and mailing services, things of that nature. So again, I can't really speak to the fact that the historical distribution of information was poor, but I could tell you that within weeks of us receiving indoor air data at this point, it gets put up on a GeoTracker, and we're cobbling together a fact sheet that'll send you links to GeoTracker, give you updates as to what's happened with our interpretation, whether the concentrations are stable, increasing, decreasing, what have you. So that's our goal, and that's how we're handling it going forward.
It sounds like this was identified as a potential problem in 2016, like a likely problem in 2016, but because there was a delay in letting anybody know about it until 2020. So that's not really a question, but I mean, it just, as somebody who was there for a long time, every day, brought my daughter there, trained a lot of people there. It's been disheartening, I guess, to find out so late in this. and I just, there, I mean, I looked up the health and safety code in California for like, you know, you have to have those warnings at gas stations and in a lot of stores that you can't expose people to like a chemical with like carcinogenic properties or reproductive toxicity without warning them. So like a lot of people post these signs, but this didn't fall under that, even though this is carcinogen.
Right, that you're referencing the Proposition 65 unit.
Yeah, yeah.
Right, I believe there's certain concentrations that need to be met in order to qualify for that notification. Like I said, we did discuss that the concentrations detected here, and it did not qualify.
Oh, I thought that, I mean, I don't know, because I'm not a lawyer. I mean, I'm just reading through this. It says that the exposure, like you'd have to notify people, assuming that the exposure was 1,000 times greater than what you actually detected, which would seem to, it seemed like this would fall into that. But I mean, honestly, this is not my area. So we're saying
Right.
that definitely not, the concentrations are definitely not high enough to notify people.
Well, we're notifying people now is all I
Yeah,
can
no,
tell
I
you.
appreciate that.
And
It's just a little
Yeah,
bit for like my business, for example. But which I understand, you know, I'm glad that going forward, and I guess that's my other question. I mean, for just for some understanding, like, you know, we closed quickly because we found out about this all of a sudden, and it felt like we hadn't been informed about a lot of things, and that was like very distressing, you know, to try and understand all this stuff within the course of a few weeks. But anyway, so that is just some feedback as far as like,
okay.
make sure that that happens. And that's all I had.
Thank you. Chip Gribbles had his hand up again for a while. Let's go back to him.
Yeah, thank you. And by the way, thanks Ron and Emma for being proactive in having this forum available for the public. Despite what failings the various agencies may have had in the past, you guys have been, I think, proactive in having this public meeting. I have a question about the not the PCE contaminants, but other contaminants. So the building history before there was this release of this dry cleaner processing business there, it includes a bottling operation, soda bottling operation, I believe, and that would have involved by today's measure, an ungodly amount of fresh water used all the time to hose down everything. That's a lot of water going to the sewer drains, to the floor, and you can well imagine that you'd have some subsurface void spaces being created with all that water going through the system, especially if you consider the age of the building. A casual floor inspection in various tenant spaces there show that some of the flooring is highly cracked in very poor condition. Other spaces look like they've had their floors reconditioned, and that's another considerable penetration or leakage space for these vapors, whatever vapors, to come into the indoor air space. Comments from some of the people that have been in that building, worked in that building. There are other odors present, or at least have been present. The description sounds to me very much like sewer gas, but we don't know about other contaminants. And given the age of the building and the types, the way they constructed in those days, in particular the sewer drains, clay pipe, most likely, whatever it is, it's undoubtedly, I bet real money, that it's in very poor condition, unless that's been renovated or redone in recent years. So two questions, actually. What about the city? And I don't know that the city building department is on this call, but I don't know if you've had any constant conversations with them about having them require a renovation of all of these subsurface sewer drains in below this building, because that's got to be involved in whatever contaminants are involved here. To have all of those utility lines redone, the drain lines redone, and also having the city require that these floor failings be reconditioned to repair that, simply on the basis that you've likely got sewer gas coming into the building, disregarding the TCE, PCE business temporarily. And so that's a question for the city. I don't know if anybody can respond to that. The other question is for the water board. What other contaminants have you evaluated for other than the PCE, TCE series?
Yeah, that's
and the idea there is somebody in one tenant space could be pouring God only knows what down their drain, and vapors coming up somewhere else because of the likely condition of the drain lines.
Mm-hmm. Yeah, so one of the other contaminant possibilities that was evaluated back when the initial environmental assessment was completed, there was a previous underground storage, or maybe it was an above ground storage tank located on the eastern side of the property along, I think it was 10th Street. And they did find there were some residual petroleum hydrocarbons that might have been released from that, but they were at low levels. So that was not established as a contaminant of concern at the property. Right now, the only contaminants that we are identifying in our lab testing is PCE and then trace amounts of TCE. And also in response, I don't think anyone from the City of Berkeley Planning Department is on this call, but I can pass that along to them. And then also in terms of sealing floor cracks, Ron and I did walk around the site, I think it was about a month ago. And, you know, Chip and I, like we spoke earlier and you did mention you saw some cracks. We went and checked it out, and yeah, there are definitely a lot of cracks in the floor spaces. We noticed some pretty big ones. So we did require the property owner to fill those cracks recently. So, I mean, I imagine that we'll probably go back out there again shortly and make sure that they did do that. We were informed that they did seal the cracks, but we'll, you know, likely go back out and just triple check that that's been mitigated, because that's definitely a very strong potential pathway for vapor migration.
And just to pile on, I mean, through our walk, we saw sealed cracks, we saw some unsealed cracks. There's going to be, you know, it's a building this age, yes, there's going to be some issues with the cracking. That's why we're getting after the vapor underneath the building. The sewer, you know, our focus has been on the chlorinated solvent issue that's been identified and known, and we're working off that. I don't know really how to comment about the sewer. I'm not sure that the city's going to have a private landowner get after their sewer system. I just don't know the answer to that, Chip, but we could certainly explore that. I'd imagine with a building of this age, there's some existing sewers under the building that don't operate, and so or pipes, that is. So bottom line is we're confident that our vapor mitigation system, you know, when it gets constructed, will be effective in sucking the vapors out from underneath the building.
Thank you.
And Jennifer just asked a question in the chat about cracks under flooring.
Let me get to the chat here. Okay, well, I see something from Tina in the chat. What am I missing?
I think Jennifer sent it to me directly.
Oh. So can you repeat the question?
Jennifer, if you want to unmute yourself and provide a little more detail, but you can, but in the chat, she just asked, what about the cracks that are under the flooring?
So under the flooring, I believe it's just dirt. It's a crawl space underneath the floor. Or unless she meant like cracks in the foundation slab, which is what we were referring to with the ceiling.
And I could take a crack at Tina's question about PCE concentrations extending beyond 9th Street, and what's the rationale for limiting the immediate 101 or 1001 Camelia Street property, considering vapor intrusion may be occurring. We have some passive soil vapor data that was collected as part of the grant that shows some vapor migration off-site, but given our focus has been currently, just focused on the on-site area where we have known vapor intrusion happening. Those areas will be further investigated, Tina, as we go forward into the grant scope through groundwater testing and further soil vapor testing off-site. But at this juncture, we're trying to get our head around the on-site issues and move to the off-site as time allows, in short order, before the end of the year for sure.
I also believe there were some buildings on the other side of 9th Street. I think the consultant might be on this call, so he can correct me if I'm wrong, but I'm pretty sure those spaces, they did do some indoor air sampling and it came back non-detect. We will be doing a much more comprehensive off-property investigation. I think our goal just in the past few months has been just to mitigate the high concentrations that we might be seeing in some spaces, or higher than the screening limits, just to try and mitigate that for the future. And now that that's underway, we will be starting our off-property full evaluation. So hopefully that answers the question.
I was just unmuted to clarify the question about the cracks under the flooring. Some of the units, well, we put in wood flooring over the subfloor. And so how will that be, I mean, for tenants that are still in there, if there's a carpet or if there's wood flooring over that concrete slab, how does that get remedied?
So Ron and I actually recently went and had lunch at the restaurant that's currently there. And it was, from what I believe, concrete flooring. So it seems like they did remove the wood flooring. And in all the tenant spaces we did go into, it was concrete flooring as well. So we were able to see the cracks, if there were any, pretty visibly.
Okay, and then quickly, Laura's asking in the chat, at what rate do we expect new cracks to form, as we're continuing on the subject?
So I do have a little background on this because I did work in geotechnical foundation engineering for about a year before I started this job. So, I mean, a building this old, as the soil beneath the building shifts, you can get cracks over, sometimes they take like years to form, sometimes a decade. It just kind of depends on, I guess the rate that soil might be moving underneath the property. Also, if there's an earthquake, that were to happen, there would certainly be some new cracks that would form as a result of that. But, cracks usually form over a long period of time. So, maybe something that we might do contingent to in the future, if we, when we get to the point where we would finish this cleanup, something that we would likely put in place is we call it a soil and groundwater management plan. And it's something that, you pretty much bind whoever owns the property to it, even if the property isn't under regulatory oversight anymore. And something that we, might include in there is regular, surveying and sealing of the cracks over time, assuming the building isn't redeveloped in the future.
Great. Sounds like a situation being monitored going forward? Okay, so Dean has had her hand up for a while. You should get a request to unmute yourself.
Thank you, I did. I have a couple of questions here. One is regarding the cracks and having them come fill them. I had two gentlemen show up at my warehouse and they walked in and said, so we're here to fill cracks. And I'm like, okay, it was just off the cuff. And they're like, where are your cracks? And I'm like, I don't know which ones you're here to seal or fill. No direction was given to me, no information, just random people showing up to fill cracks is really an epic fail. So I think we got them. They didn't know what they were doing. They were just putting cement in stuff. My other question is in regards to the map you had up earlier, where the venting slots, I guess, are going to be for the off-gassing. Yeah, that one. Two of them are right next to my front door, which I have to have open to suck clearing air into my warehouse, which is the for your dogs tonight, $13.95. So will I just be sucking in bad air? Or is there some sort of a filter process going on with those vents?
Yeah, so when the air is sucked into the vacuum and discharged, it is treated. They're not, just discharging the air that was under the slab to the atmosphere. It will be treated. So you shouldn't have any, PCE being, fired directly into your space. Yeah, and then in terms of the crack sealing, that was something that we instructed the property owner to do. So they coordinated that. I'm sorry they didn't, coordinate that better with you as a tenant. We can't really comment on that.
No, and I understand. I'm not asking you to comment. I just wanted you to be aware of.
Yeah,
it was completely random and odd.
Yeah, I appreciate you letting me know though, just because we don't get to see those kind of inside activities. So it's great when you as tenants can just kind of keep us cued in.
I know they tried to go into another space and they weren't allowed access. So there was also that.
Okay, interesting. Thank you for letting me know.
Sure.
Well, yeah, and you can see, communications, like getting this information out there, informing it's a challenge, as you can tell. This is the first we've heard about it, and so we need to follow up with the owner and try and come up with a better way to communicate how these cracks are being identified and mitigated along with this whole plan. So
yeah, well, they can send someone, but if you had recorded or given me some information about the cracks that you were suspect of, then I would have at least had that information. And I would appreciate if when you come to do it again, getting something like that, just so that I can help facilitate it being done.
Sure, yeah, we can definitely do that.
Thank you, dears.
And Margot Schuler has her hand up again.
Thank you. I once again appreciate that the immediate project is to do vapor remediation of the immediate impact on the existing tenants. I wonder if there is still a future soil and groundwater remediation of the contamination coming.
Yes. So as we do more investigation, now that we're getting these mitigation measures in place, we will be doing more remediation as needed. And as we get that data and come up with plans, we will notify you guys, just so that everyone's aware of our site activities, even beyond this vapor issue. As we go off property and do groundwater stuff, everyone will still be cued in on what's going on.
So Margo, the next thing, in short order will be the excavation work that you'll certainly notice, vehicle traffic and fencing going up, things of that nature. So that's tied into what, we're terming a source removal. We know there's elevated concentrations of PCE in soil near the loading dock. And so we're going to get after that. That's been on the books here for several years. And so now that there's funding through the SCAP grant, and this is included in the SCAP grant, it'll be completed. There's also funding in the SCAP grant for additional groundwater remediation as well. So try to tie that into Peter's question in the chat about future funding. The way the grant program works is you have to work through the existing SCAP grant scope and budget prior to applying for a renewal or getting a renewal. So that's what we're doing. We're going to get after the groundwater and the scope of the groundwater remediation investigation and the excavation work so we can exhaust this grant and get a revised grant that'll address further offsite issues and the on-site issues associated with the vapor mitigation and vapor cleanup under the building.
So I'm sorry, I may have missed it. When do you expect that excavation work to begin?
I would like to, again, I'll be speculating a bit here, but as we sit in the middle of May with the excavation permit now that we have the excavation permit, the city of Berkeley will allow the contractor to get the encroachment permit to take up the parking spot and block the area. I'm hopeful that that's a week to 2 week process once it begins, and then they break ground sometime in the June-July timeframe. And I think that would be the best case scenario I'm portraying.
I'm sure this is a bit in the weeds, but is there any way for the community to weigh in or understand what the traffic protocols are going to be on that? Are you going to be accessing the site from Gilman? Are you going to be accessing the site through the neighborhood? What's going to happen here, and how much soil are you planning on removing?
Yeah, so I believe the property owner is going to issue some kind of informational, I don't want to say pamphlet, but they did kind of say that they planned on informing all the tenants of, how access is going to be affected because of this construction project and the timeline, the schedule. So that might be a better question to ask the property owner once the consultant sets the schedule timeline. What was the second part of the question?
I guess the question is not so much if we're talking about doing this within 2 to 6 weeks, there's not a lot of time to ask somebody who's not clearly very responsive. So I'm asking, who's controlling that traffic? Is that the city's permit? Is that your purview? Is that, who's got the contractor?
Right, that'll be a city permit. I'll confirm that there's a traffic, usually there's a traffic
Yes, there
plan
is.
associated. Anytime you take a parking spot or you're going to be creating some type of a lane closure, things of that nature, the encroachment permit will likely have some type of a traffic plan, and that's where it'll be informed. Well, yes, the trucks will come in off of Gilman down 9th Street or down 10th and around to Camelia Street and out to Gilman. I'm confident Gilman will be the access route just because of the freeway access.
And having lived in this neighborhood for 30 years, I'm confident that Camelia Street will be the route of choice for the truck drivers.
Okay.
I think that it needs to be not in the residential neighborhood. Please keep it on Gilman.
Okay, well. Right, so here we go again, Joe. So we have a plan in place, and I mean, these plans, they'll tell you how far to put the cones across and something like that. And then you get, a truck driver that's gonna do what they do. So.
Well, yeah, but we can control that, and I would love to. I will talk to the city of Berkeley. Can you tell me who the city permitting name is so I can contact them directly?
Yeah, I can go ahead and put their name and email in the chat.
Perfect, that'd be great. Thank you, Emma. Thank you.
Yeah.
All right, so let's go to Chip. Would you like to respond to this specifically, or do you have a new question?
New question. If you want to go to somebody else first, that's fine.
Okay, let's go to Bahia, representative from Bahia.
Hello, my name is Beatriz Leva Cutler. Here I am. Hello, I'm Beatriz Leva Cutler. I'm the director of the Child Care Center across the street. And my question is more in relation to being across the street and the mitigation cleanup and how, if at all, it would impact both my families, the children who are outside. Should we be closed? I mean, I don't know how this cleanup happens. And I'm sorry, I missed the first part of your presentation.
Yeah, no worries at all. So this, the activities shouldn't be impacting enough to where, people would have to close. I'm pretty sure that the treatment units are parked in a couple parking spaces on the main property right now. And that's where the cycling of the air is occurring. So, again, there's no discharge of like contaminated air into the atmosphere. That air is treated before it's discharged. So there shouldn't be, any issues with being outdoors. There might be some slight noise coming from the machines, but yeah, that's all I really think will stem from it.
And the machine is inside a box truck, should be dampened a bit. Again, and that treatment system is permitted through the Bay Area Air Quality Management District, and those permits require ongoing testing of the effluent after the post-treatment to ensure that the atmosphere is not being contaminated more than it is from normal life.
Yeah.
And so, no, I do not understand or do not see a reason to close your business whatsoever.
Can I suggest that on the telephone post that notice be put to the community what's going to happen and when it's going to happen?
Yeah, so something that we'll definitely be doing probably this week for the vapor mitigation system, and then before the excavation is we'll be sending out a work notice. The excavation will give some more notice than we, unfortunately didn't get a chance to issue a more, I guess, specific work notice for the vapor mitigation system before they put all that piping in place. So we'll definitely send something out letting people know like the 30-day pilot test timeline and when they can expect it to be over. And for the excavation, since that's going to cause some disruption, we certainly will be issuing a work notice before then.
Thank you.
And
I envision,
oh, sorry, Ron, go ahead.
Reality that we'll probably post the excavation work on a public telephone pole, if you will, for lack of a better word. But I'm not convinced we'll do that for the on-site mitigation system. I think that's more to the building, and once we get off into the right of way, then it makes sense to inform folks what's going on.
Great, and I just wanted to add to that we're planning to translate these work notices into Spanish, at least. But if you have any other language access needs that you know of in the area that would need translation for any of the community members nearby, please let us know, and we can make that happen. Okay, Chip, back to you.
Yeah, thank you. Thank you. For the floor ceiling piece, it sounds like that may not have been an order from the water board, but a recommendation. If it was an order, I think you're probably going to want to have an approved work plan, probably with not a whole lot of detail, but should be fairly straightforward. Their process for sealing the floor. If it's an informal thing, they could be advised that it would be in their interest that they provide a simple work plan that describes how they're going to seal the floor or fix the floor penetrations, with you providing some informal feedback to ensure that this is done in an effective manner. And also some quality control, quality assurance kind of piece to that work plan and approval process as well.
Yeah.
And I'm sorry, Emma, one more thing you said, I think at one point you said crawl space. I was under the impression that the whole building is a slab on grade, but I'm thinking maybe parts of it have a crawl space underneath the floor. Is that correct?
Correct. On the left half of the property, closer to 9th Street, there's a crawl space.
And yeah, I'm not sure. I don't know if it's just an elevated floor, Chip, filled with gravel, or if there's a place for you to crawl around in there. But that's going to be, that you can see it if you stand there opposite the loading dock looking east, and you can get a sense that that side of the building is elevated a bit a piece.
Yeah, but Chip, I definitely agree with what you're saying about the floor ceiling. I mean, clearly, since it, Ron and I went back after the initial round, and clearly there were still cracks there. And the fact that, they seemingly just kind of sent guys in to, look around and be like, what's this? So, clearly Ron and I need to go back and take another look and see, what's the deal with the cracks. And I agree that definitely a more aggressive enforcement measure will probably be needed for some further floor sealing if needed.
I'll respond to the question in the chat about the SCAP work. So the state board will not reimburse offsite property owners doing any work that's outside the grant, whether or not it's deemed associated with this property or not. It's just, they don't work that way. And then also, please confirm you stated that SCAP, yes, so there, I believe there's offsite remediation proposed. It may not go very far offsite currently, and it has yet to be defined as to where those locations will be. But if there's scope in the grant to do offsite remedial action for groundwater or vapor mitigation or vapor remediation, that is subject to reimbursement by the grant, but it has to be conducted by the grant applicant or grant party. In this case, the owners of the property we're speaking of. So I don't know, Tina, does that answer your question? If you're even here still. Oh, I do not see her name. Okay. Well, oh no, there she is.
Sorry.
Tina responded yes in the
Oh,
chat.
there you go. Okay, gotcha. I'm learning this stuff too here. Okay.
Okay, and it looks like I think we've addressed other questions in the chat.
Oh, there are more. Okay, let me find the chat. Oh, okay, that was Dina. I think we answered Dina. How am I to get airflow if I cannot open my front door while the loading dock is being removed? Well, yeah, that, to my understanding, that the fan that's in your ceiling, it's going to do what it's going to do, whether it's, going through the cracks of the door or just pulling air out from the interior of your building. But clearly when that excavation's happening for the time it is, you'll want to keep that door closed for safety and noise and dust and etc. So there'll be ways to mitigate that, but I think closing your door makes more sense than not for that time frame. Okay, what is this now? Oh no, that was Tina.
All right, if there's anyone who feels like their chat questions haven't been answered, please let us know.
There's something about a sinkhole. A big sinkhole opened up in the floor of the fitness gym while I was working there. Could this keep happening? Well, I suppose a building of this age, I don't know if that has anything to do with the PCE, but yeah, I would imagine it's possible for there to be a fail. Again, I don't know that that's associated with what we're trying to do here. Got the long-term funding. They got that one. Oh, okay. I think we're caught up in the chat.
Yeah, so looks like Chip has his hand up again.
Yeah, I think the sinkhole idea and the potential for void spaces under the slab on grade portions, or even some of the internal supports for elevated sections, and that's very easily understood if you think about the history part with the excessive water usage in the bottling history of the building, and developing washouts or void spaces, a lot of soil underneath the slab on grade because of all of that, and all going into the sewer lines or the backfill trenches wherever they may be. So that also speaks to specific pathways or larger pathways of vapor movement under the slab on grade or floor.
Okay, yeah, I don't know if the water board's going to be doing much investigation towards the sinkhole, I mean, issue, or we're going to be we'll be excavating soil on the side of the building and pulling vapors out from underneath the building and seeing what effects that has on the indoor air and the quality of air underneath the building.
It looks like Laura's clarifying her question in the chat about if a new sinkhole were to open up, would that be a potential vapor intrusion point that could increase indoor exposure?
Well, I guess yeah, if you have a big crack in the floor, certainly you could have vapors, coming through the sinkhole in the floor. Again, we're hoping, the plan at least is, and the design will be to overcome any of those factors by actively putting a vacuum underneath the building to draw those vapors out so they don't accumulate in a sinkhole or a sewer pipe or a sewer pipe conduit, things of that nature, to get that air to move out from underneath the building.
So it sounds like something that's not a known risk at this time, but will be, continually monitored along with the cracks.
So yeah, certainly any crack or failure of the slab would be part of a mitigation, should be filled with caulk or some type of a grout, some way to fill that void. It would also, potentially, if you have a strong enough vacuum, would hold clean air from the room where the crack is down into the subsurface, and kind of short circuit, if you will, the mitigation system. So it's in everyone's interest to have the cracks filled. And as a tenant, you find a crack, you certainly reach out to the water board or your landowner, landlord, or all of us, and we'll do a better job of communicating the schedule for someone to come out to fill that void.
Okay. So at this point, I'm not seeing any new questions or new raised hands. If that's the case, we can go ahead and adjourn. If anyone else would like to ask a question, we can go ahead and do so. And as it says on the slide here, you can send your additional comments or questions over to Emma, and I'll drop her email in the chat right here. All right. So seeing no further hands, great, thank you, Margot. Yes, as a reminder, we're here to help be the communicators between the remedial activities at the site and with the community. So we're here to answer your questions. We're here to listen to what you have to say. We value your input. And we really appreciate everyone's participation and your patience today and respect. All right, any last words from our other panelists here?
Nothing except, thanks everyone for taking the time, taking, almost 2 hours out of your day to come and listen to this and to ask your questions. So we really appreciate it. Public participation is very important to us. And so it's great when there's, public people who are willing to participate, of course.
Great.
Right.
I look forward to ongoing discussion. Oh, go ahead, Amanda.
I was just gonna say, yeah, thanks to everybody and thanks for voicing the different perspectives.
All right, great. Well, thanks everyone. Enjoy the rest of your afternoon and we'll be in touch soon.
Hi, I'm Emily Pillaton Lamb. I'm the founder and the executive director of Girls Garage, which is on the 10th Street side of the building. I have a couple questions, but I'll start with one because you just talked about the numbers related to the risks. And so thank you for that. However, so much of that risk assessment is based on the data from the readings in the building. And I'm wondering how we can be assured that the protocols and the techniques being used to take those measurements are accurate. I'm specifically asking because in our space, there have been times when the sampling device was hung and collected 24 hours later and times when it was collected 10 days later. So I understand the data that you presented, and however, I do not feel like I have the assurances that the testing methods are giving readings that can accurately be compared to what you just showed. So could you address some of that, the testing procedures?
Yeah, so Ron, do you want to talk about this and maybe?
Yeah, I could take a first shot at this. So there's different techniques to collect these indoor air samples. In a commercial facility, you have an option of, you probably have seen these, they're called SUMA canisters. They're kind of a cylindrical device, stainless steel typically, and it sucks air into the sample device over an 8 or 24-hour period of time. For commercial uses, it's generally an 8-hour period of time. That canister is then taken to an analytical lab and tested for the chemicals of concern under what's called a TO15 or TO17 analysis. We get the data back from the lab. It says what was found in the air. So that's one method of collecting the sample. Another method you may have noticed is where they hang a small device that allows air inside the room to collect onto an absorbent tube, and that hangs there for anywhere from 24 hours to 2 weeks, and that tube then is taken to the lab and measured and analyzed as well. The amount of time that it's allowed to absorb factors into how the concentrations are reported. If it's there for a longer time, there's a certain equation that's used to factor that amount of air that would be exchanging onto that absorbent tube. And I believe for this particular project, they have used both those SUMA canisters and the absorption tubes. Both are endorsed by this agency and the US EPA for collecting indoor air quality data. So that's the state of the industry at this time. And I don't know if that answers your questions. Let me know, Emily, if that's not clear.
Yeah, thank you for that. Just for the record, I've never seen one of the canisters in our space. I'm not sure about other tenants.
What have you seen, the tubes then?
Yes, the small things that are hung on the wall.
Right. Those a little more user-friendly, easier to obtain from the laboratory, from the lab. There tends to be, at this particular project, when you need 20 to 25 of those Suma canisters. They're not always readily available to rent from the lab, and so then that could make the contractor default to a different analytical method. We've seen fairly good coordination between the two collection methods for this and other projects. If everything was coming out, clean or non-detect, we would probably have a bigger question. But since we are, in fact, measuring chemicals, we have a good, obviously something's being measured. And, I guess just the nature of indoor air testing, we kind of touched on this a little bit earlier at the afternoon meeting. It could be very, very variable. Someone opens a window, someone closes a door, the room gets sealed. Barometric pressures, there's a lot. Somebody could be storing a source of PCE inside the building, inside the room. So there's just many factors that go into this data or into indoor air testing. So it can be confounding, but in general, we feel that this data set for this project is of high quality.
Okay, thank you.
Mm-hmm.
Anyone else who would like to ask a question, you can go ahead and raise your hand. All right, I saw Christina first. Oh,
hi, I'm Christina Yoshida. I actually work for the water board, but that's actually not why I'm here. I have kids who go to the preschool across the street, and I live down the street. I was wondering if you could give an overview of the results across the street at the two schools. I'm wondering if
so there was some indoor air sampling completed across the street. Those concentrations did come back non-detect.
Okay, great. And I was also wondering, when the excavation happens, I'm wondering if there are any risks, elevated risk when that happens.
Ron, do you want to touch on that?
Right, there's that's kind of part of the permitting process with the city. However, the scope of work will be to mitigate the dust. I think we'll be opening up the ground that has the contamination, so there's a chance that this material will volatilize up into atmosphere. General practice is to wet that soil with a fire hose or garden hose to knock down the dust, so it doesn't so we don't have fugitive dust going out into the neighborhood. There's also the opportunity to do perimeter air monitoring at the site of the excavation, and so that would lend itself also to is the dust being mitigated enough? With handheld instruments, we can determine if more has to take place. So let's see, that is pretty much the excavation will be open for some period of time while this is happening, until we get clearance to backfill it through analytical testing that will happen. So yeah, I think that's it should be relatively minimal exposure to anyone in the neighborhood. We have to remember that it's going up into atmosphere. The further away from the excavation, the less chance you'd have to be exposed to any fugitive dust. So across the street, it's hard to, I guess if you had a wind blowing directly to your location, you'd have some potential exposure, but in general, it's going to be pretty minimal, given that it's diluting up into atmosphere.
Okay, let's go to Chip next. Good to see you again.
Yes, hi, thanks. So just to clarify, so the air testing has been just for the chlorinated solvents. Is that correct?
That is correct.
And So, Ron, what would you suggest regarding the other potential contaminants that are present? And as I mentioned before, the likelihood of sewer gas or other contaminants coming up through the wastewater discharge system that is likely to be in very bad shape.
Right. Well, this project is focused on what we know from the tetrachloroethylene releases with the PERC-serve operations. The water board is not aware of any sewer gas issues or anything in the sewer. You know, it would be if we had some data or reason to suspect that, we could look into that. But this project is focused on the solvent release.
And so again, are you going to be coordinating with the city building department or permitting department or city public health regarding the other issue that may be related to the building conditions in terms of the wastewater collection system and its condition that could be facilitating more bad air or contaminated air coming into the indoor airspace, including TC contaminants as well?
Yeah, well, we could screen the sewers for solvents, but if you had some specific chemicals that you had in mind, Chip, we could assess that. But at this juncture, you know, we're looking at this as a solvent, you know, PCE project, and that's been driving the project.
So if you did test the sewer gas or sewer pipelines and maybe even the backfill, and you found TCE, that would be a basis to go to the city and say, by the way, your system that you've got some role in overseeing is facilitating or maybe facilitating the distribution of the chemicals that you regulate to penetrate into the indoor airspace.
Well, right. I guess the city would be responsible for sewer pipelines outside the footprint of the building within their right of way. I would think property owner is going to be responsible for infrastructure underneath the footprint of their building.
Well, okay, we could go on, but actually a building that doesn't have an intact sewer system and that's causing other public health issues, that's a public health issue, right?
Sure. Right.
Okay.
Yeah, I can't comment on the condition of the sewers at this point. I don't believe there's been a camera run through them, or there's been some surveys to locate them on, you know, in the subsurface, and we mark them on the map. We can see where they go. I'm not aware of any videos of the sewers to see if they've have holes in them or sags or that condition.
Right. Can I ask another question, or am I going?
No, go
ahead. So does the water board know that throughout this property, are there any stale air areas like small rooms or hallways or closets that may be cut off from the type of ventilation or air circulation that the rest of the buildings, subdivided buildings might experience, and thus be more concentrated in terms of their PCE, TCE concentrations?
So you broke up at the beginning there, but just to clear, are there areas within the building that have stagnant air?
Yes, like closets or hallways or small partitions that just don't get the same degree of air mixing that the larger rooms get, and thus may not be reflected in the data set that they're using for the characterization.
Right. So I would think that, yes, within each structure, you know, Emma and I have walked the building once and noticed, yes, even within, you know, for example, the New Age Meats, there's plenty of small corridors and hallways within that structure or within that space. And, you know, I think it's fair to assume that the airflow is not uniform throughout any one tenant space at all. Even, you know, the dog bed place, there's small rooms in the back of that facility that won't have the same airflow as the huge, as a larger space. So yes, there's going to be different airflow at different places at given walls, barometric pressure, doors, windows. Sure, I think that's fair to say there'll be a variable airflow in areas with stagnant air to some respect.
So I think that with given the risk assessment that Amanda was describing, I think it might be appropriate if there was, and maybe you've already done this, direct communication with each of the tenants, or to make sure that the communication reaches each of the tenants, that the risk assessment that Emma is describing is really based on a voluntary compliance with ventilation assist, if you will, fans, windows, open doors, that type of thing. And that these people might be well advised to also increase the ventilation to some of those closed spaces.
Yes, that's a good idea.
Thank you.
Huh?
Before we take Margot's question, I just wanted to answer Rena's question in the chat live, just so everyone can, maybe if they haven't seen it in the chat. One of the questions Rena asked was what agency would oversee or maybe have another opinion on vapor hazards if there's like health and safety issues in the workplace. I know OSHA might seem like the likely contender, but usually Alameda County Department of Public Health is the main purveyor, simply because it's a environmental issue. And so they oftentimes, you know, if a building is contaminated, they might have, you know, some say or some determination on occupancy. The water board does not make occupancy determinations, they do. And then another question she asked was, is there any reason to believe that tenants should temporarily vacate the premises during the excavation efforts? So part of the excavation plan is a, you know, public safety portion where they do go over, I guess, dust mitigation measures and how to make sure that any soil being dug out of the ground, you know, there's very limited and ideally not at all, you know, additional vaporization into the community. So that is, you know, part of why all these permits are required for it, is to make sure that we're in compliance with limiting the amount of dust. So for that reason, it should be totally fine to occupy the premises during the excavation.
And can I just add for the OSHA threshold? So those are for people who know that they're working with a certain chemical. So like if they were using PCE on the job, and the OSHA threshold for PCE is 170,000 micrograms per cubic meter in comparison to the thresholds the water board is using of 2 and 180. So it's a much higher threshold because usually people know that they're working with it and they may have access to PPE and those types of things.
Great, thank you for the clarification.
And yeah, one more clarification for Chip. Chip, there was some continuous air monitoring done towards the end of 2021. The document obviously is on GeoTracker, but you could see, this is, I don't know if you're familiar with this fellow, Blaine Hartman, who has a portable machine that he'll go out there and take continuous air samples. And he was hired to do this here. And there's graphs of the data that you could see when people would have their businesses open and turn fans on or open windows, the concentrations would go down. And then at night when things would stagnate, if you will, the concentrations would build back up. So clearly the
movement of air is key to mitigating this issue.
Yeah, could you put a link in the chat for that Blaine Hartman's study? I'd like to look at that, please. Thank you.
Oh, I was counting on you. I thought you had this GeoTracker site down, man. Okay. I have it right here.
I also noticed that Margot, you had your hand up. Did your question get answered?
Yes, thank you. I was going to ask about the dust mitigation strategy. Thank you, Emma, for answering that.
Okay, great. All right, we've got Laura with her hand up. Good to see you again.
Yeah, thank you. Yeah, so I was in the earlier meeting, and I'm sorry to like harp on some of the same points, but I've really been thinking in particular about the data. And I really appreciate that you're being so diligent and taking all these measurements, really making sure to have a lot of different points of measurement and doing it continuously over time. As somebody who, I myself work with data, and so I appreciate that there's a lot of rigor in the attempt here in terms of trying to get a lot of different measurements to make sure that we're taking care of this going forward. And but I'm also like really hearing how sensitive these measurements are to, you know, the movement of air. We talked a lot about that, but also I'd like to point out the movement of water is also key. So as groundwater flows under the building, that's actually what's, I mean, this is my understanding. I really can't wrap my head around much of the technical details here. Chip Gribble has helped walk me through a lot of it. So Chip, correct me if I say anything wrong here, please. The only part I can make a sense of is the data, but everything else is very technical. But my understanding is that as the water flows underneath the building, you know, when there's like heavy rainstorms, for example, that itself can also dramatically increase the amount of vapors that are entering a space. And when I say dramatic, I mean like by magnitudes of hundreds or maybe even thousands of times. So, you know, I think about how sensitive these measurements are. And I think about, like, Emma, you just shared how they closed one crack and that alone had a significant impact on the air concentrations. You know, and I'm thinking about, I used to work at Phoenix Gym. I haven't worked there in years, but when I worked there, there wasn't just one crack, there were many cracks. We had a sinkhole open up in the middle of the floor. And I noticed as we were doing a lot of the more recent measurements, the Phoenix Gym space was not measured recently, which I was disappointed in because I was really interested to know what the measurements would have looked like before the cracks were closed. And although, I mean, I think that, you know, as I think about the sensitivity of the measurements, and I think about how when I was working at the gym, it was a period of very heavy rainfall and there was a lot of rain. And now that the newer measurements are being taken, they're being done in years where there isn't quite as much rain. So that could definitely impact the amount of vapor entering the space. And I think that you're doing everything correctly in terms of mitigation. And I really appreciate what you're doing here because you're having these extremely low thresholds, 2 micrograms, and you're acting on these low thresholds and making sure that changes are made to preserve the health of people going forward. And I really appreciate that. And I think that you're doing a really good job when it comes to that. I guess the one part that I'm having a struggle with is that when the potential health risks are represented to the community, we're not just talking about the future community going forward. There are people in this meeting who haven't been in the space for years, but are here because, you know, like I'm personally concerned about my potential health impacts. And I'm also troubled to hear, and this is the second meeting that again, it's being portrayed as this very low risk situation health-wise. And I understand that that might actually be appropriate information going forward, especially as we put mitigation efforts into place. And I don't think it's good to be alarmist and get people, you know, all worked up over scary sounding chemicals when the thresholds are low enough and being monitored, and we have fans in place, et cetera, monitoring the cracks. All of that makes me feel really relieved and really grateful to all of you. But I am struggling with the way in which the health risks are being presented to the community, because I really do think that a distinction needs to be made between the health impacts going forward and what the impacts might have been in the past. And I'll just share my personal story. I left Phoenix Gym at the end of 2017, and I was really ill, and I was getting increasingly sick, and my doctors could not make sense of it. And I have a very healthy lifestyle, and I was having impact to my organs. I was having vision changes. I was like seeing things. I had all kinds of health things going on that made no sense. My doctor at the time asked, and then when I left the gym, my health dramatically improved within a matter of months. And my doctor at the time asked me if it was possible that I had been exposed to any toxic chemicals. And I told her no. I told her that I did not think that I had been exposed to toxic chemicals. But I did notice the timing of having left the gym, and I wondered about that. But honestly, it just seemed like a really far-fetched question from my doctor until I learned that actually I was exposed to PCE. And so this has become a whole health journey for me in the last few months. And I've been working closely with my healthcare providers. Today I was at UCSF with the top toxicologist there, and he's helping me plan for future health impacts. And I guess I'm just concerned that there might be other people out there like me who maybe could benefit from knowing that perhaps they were exposed to levels that were high enough to cause acute symptoms. And I haven't heard any mention of that really. And I really hope that we can adequately transmit to the many hundreds of people who have been in that space that we do not know what the potential levels were, but I would go further than that. And as a researcher, I know there's a big difference between admitting that we can't know something with certainty, but that doesn't mean we cannot say that there are possibilities. And I think it's important, given the data and given what I understand from Chip, who has been working closely with me to better understand the situation, there actually are concrete factual reasons to believe that the recent measurements do not accurately reflect the measurements in the past. And further, there's reason to believe that the measurements in the past could have been much, much higher. And so Amanda, researcher to researcher, I just have to ask you, like, would you consider perhaps breaking that down in terms of, of course, we need to think about this going forward. We're being very conservative in how we, respond to measurements. But I hope that we can also explain to the public that we don't have the correct kind of data to generalize to the past. And that we know that the data themselves are quite sensitive, that the measurements are sensitive to all kinds of variables. And we know, this isn't just speculation, we actually know that some of those variables have changed, and we know how they have changed, and we know that those changes translate into decreased measures, sometimes dramatically decreased measures. So it just troubles me to keep hearing, again now, the second time now, this presentation that feels very reassuring about the health impacts. Because my personal experience is that I've had a lot of health concerns that were very mysterious to me, but like reading the fact sheets explaining what the effects of PCE, it makes a lot of sense. And it really has changed my experience of my own health to know this information, because it's given me the courage, honestly, to go back to my healthcare providers and say, we need to take another look at this. I have new information. And it has led to progress in my healthcare picture. And I am receiving better care as a result. I got a referral to UCSF, which I don't think I could have gotten before, and they're being very helpful. So I guess I'm just very troubled to imagine that there might be other people out there like me. And I really hope that you all who have positions in public spaces and positions of influence could really help people understand that while we are being conservative going forward, and we shouldn't alarm the public going forward, that maybe people who were in that space a lot in the past and who have had health impacts might, consider that this was a factor and raise it with their healthcare providers. Thank you.
Well, let me start, and then Amanda, you can correct me. But yeah, so going back it's just difficult, fraught with uncertainty, and just really hard to generalize what was in the past. What we are doing is we're working with the owner to generate a list of people and contact information for these people, so we can reach out to explain to them that this is the nature of this property where they spent time. And that's about as far as the water board can take that in terms of providing, information that this is happening. Now, Amanda, you may have more information about going backwards, but that's how the regional board would look at it.
Yeah, I mean, I don't have good information about going backwards, and that is an uncertainty that we acknowledged here today and earlier. And with the possibility of health effects, I feel like I've tried really to be open to health effects, and in one-on-one conversations, I really try to think about ways in which, it could be different in your situation. Like how could have the concentrations been higher, and have frank conversations with people about that. In this setting, I think I'm just trying to deliver the short version of, I've been asked frankly at meetings, like people who just say, how much should I need to worry about this? And I have to weigh, do I want these people to lose sleep over this issue? Or, do I want to make people so nervous that they give up their business? And those are things I think about and take seriously. And from the best information available, that tells me that the health risks are low. It doesn't mean that they're zero. And I'm not saying, I can't say that the site didn't cause what happened to you. And, but I think for the general population, overall, there's a fairly low health risks. You spoke about, there are definitely ways that things could have been worse in the past. But that's also like potential scenarios that we don't know if they've happened or not. So I don't know, it's a lot of speculation. And so I feel like I have to boil it down into a 1 minute balanced message that I'm trying to get across some of this. And I hope, I think with a public meeting, we can balance, have a discussion and hear different voices, and people can hopefully get the information that they need to do what's right for them.
And one thing also, Laura, you were touching on the groundwater flow and groundwater contamination. In general, the data we have shows that the elevated concentrations of solvents in groundwater are located on the western side of this property and migrating off towards San Francisco Bay to the west. So what we have in this particular project, and not many others, is the vapor tends to go in its own path. It doesn't generally follow the path of groundwater flow. So you would anticipate if it were just following groundwater flow, everything would flush out to the west. However, we are getting elevated or detectable concentrations all the way back to the eastern boundary of the property. So clearly the vapor tends to move through preferential pathways through coarse grained soil, sand, and gravel. It could follow pipelines, these preferential pathways, essentially, as Chip was alluding to, of sewer pipes that can allow these vapors to move in directions that were not anticipated. So we feel that we're covering the footprint of this building with the a number of samples. It gives us a good data set to where we can make statements about the air quality and come up with a plan to increase the quality of the air, get the chlorinated solvents out from underneath the building and outside the indoor air, and make it so it's you know, it's not even a discussion moving forward, can't go back, but moving forward that we're all lower than these low screening criteria. That's what we're aiming for through this project.
Great. And Laura, I hope you feel like we recognize what you're bringing to the table here and what you've been through, and recognize the struggles that you've had. Okay, Chip, did you have something to add here?
Yes, or do you want to call on Emily first? That would.
Sure. Yeah, go ahead, Emily.
Hi, thanks. I just first wanted to say, Laura, thank you for sharing all of that. I echo I run a youth serving organization. We've been in the space since 2016, and it is troubling to even think about what information we don't have. And I understand it's all speculation, but you know, in the same way that all of you from the Water Board are responsible for sharing information with us, I say we collectively, as tenants, many of us who are youth serving, three who I think are all on this call, we are also responsible to answer to our families. And so we are taking the information you're giving us and we have to put it through our own filters of what we believe our families deserve, which they do. And so I just say that because I think Laura really brought to light some of the concerns we have around what happened in the past and what information we owe. So that's just a comment, sorry. And my question is actually about the remediation plan. And, you know, to be quite frank and maybe generous, this process has been extremely slow, like incredibly delayed at every single step. And so I would love to know when you expect that this remediation would be complete to the point where we don't have the need for further monitoring. And then secondly, like if there are any assurances or tools that the Water Board has to make sure that this is being implemented on schedule.
Yeah, I can answer that. So in terms of, you know, trying to figure out how long until this site doesn't need regulatory oversight, we don't know that number. A lot of cleanup sites are open for, you know, sometimes several decades. And the cleanup process is a very slow process, unfortunately. I mean, most of my, you know, I have about 36 active cleanup sites, and almost all of them have been active since the 70s or 80s. So these things do take a lot of time, you know, but going forward, we do want to try and get this done as fast as possible. You know, believe me, every case manager wants nothing more than to mitigate any potential human health risks at their site and get that site closed. So that is our top priority. In terms of the timeline for mitigation measures, right now, this week, the pilot test is happening. Everything's been installed and they're about to get started with that. And that's a 30-day long pilot test. And so after the 30-day mark, they'll do some sampling to see, you know, how it worked. And then they will start designing a more permanent vapor mitigation measure. In terms of the excavation, we do expect that to happen, I'd say, within the coming months. You know, unfortunately, we did have a very unprecedented big delay in getting that excavation permit. You know, the property owner started that application process back in July of 2021. It has taken a very long amount of time, but now the Water Board is in contact with the Berkeley City Council member, Rashi, whose, you know, purview is District 1, where this site's located. And they have offered their help going forward if we have any more issues with permitting and the city of Berkeley, so that, you know, hopefully nothing like that ever happens again, because that was a long delay, and we understand your frustration with that. So I hope that answered your question.
Thank you. Yeah, is there any recourse or tools that you all have to ensure that that's happening though? I mean, I know the delays, some of those things are outside of your purview, but you know, if the 30-day pilot test is delayed or something else happens with the city of Berkeley? I mean, how can we as tenants be assured that there are consequences when these things don't happen on schedule?
Well,
So, yeah, Ron, do you want to take this one?
Yeah, we have the ability to fine the owner. We put in a order to come up with this plan to mitigate the vapor, do this 30-day test, and we put in a schedule. And then we have our enforcement discretion. If we feel like these people are just not responding, then we start a campaign to, find them. And that's not a small endeavor. It takes time as well, as you might imagine. Legal people get involved, and it goes down that road. Now, this particular project is subject to what's called the SCAP grant, where the state of California, the water board, is funding a certain scope of work. When those grants are issued, there's a budget and a scope, and doggone it, that's what you're doing on this project. For this particular project, the scope was written prior to having full knowledge of the indoor air issues, so not enough scope or budget was allotted to that. And so we've the water board made the decision to get with the owner, and they're doing this work out of their own pocket, out of their own budget. So to qualify for these SCAP grants, the state does quite an exhaustive look at the people's finances, because they just don't want to give money away to anyone. They want to make sure they qualify for whatever hardships they claim to be or claim to have. So we're working within the scope of the grant for the most part, but now we're outside the grant, and so we're working with the owner on that. So I've gotten the inkling, they're moving. I know that the extraction points were installed last week. I got a photograph today that their treatment system has been delivered. It's in a truck sitting on 10th Street, or 9th Street, there by the loading dock. And sometime probably later this week or early next week, they'll start sucking air out from under the building, and we'll start measuring vacuum around the footprint of that building to see what what kind of influence we get. So now, that's all great. We're going hard, but then once that stops, they have to design the system, hopefully using the permits that were put into the ground here. But then there's another round of permitting that you have to get with the Bay Area Air Quality District. There will be an electrical permit, I'm pretty sure, and a plumbing permit with the city. And so there'll be another hiatus. I can't predict how long it's going to be, but it could be on the measured in months. I know these Bay Area air quality permits are not simple to get. And so that's going to be the next hurdle, if you will, as we move forward. So we're quite focused on this air issue and working outside of the boundary of the grant just to make this right, and get her done. So it's a delicate balance. You got to communicate with you folks and the owner and the people at SCAP. So, we're getting it done, and I hope that gives you some scale as to what we're up against.
Okay, thank you for that. Thanks.
Okay, and while we're on that subject, in the chat, Rena asked how much was the SCAP grant for? And what's been done with the grant funds since it was received?
Right. So I think the grant came in at about $1.1 million. So it's not a small amount of money. Approximately half of that money is allotted for the excavation work. And then some additional money is put towards the groundwater investigation and remediation. That was the primary focus, actually, of the grant. They had $45,000 allotted to vapor mitigation and indoor air sampling. So unfortunately, these grants it's the government. So, they don't like to move money. They don't like to give money, without, if it's set, it's kind of set. It's hard to adjust, in other words. So, so there clearly wasn't enough allotted to the indoor air issues here. We've moved as much as we can into that. This somewhat monthly sampling has been covered out of the grant. I think some of the the fans that were installed on the roof was out of that grant. So there's still money in the grant. We're just trying to push as much as we can into the vapor issues with as we work with the people in Sacramento who don't, maybe their hands are tied as well. I don't want to put anybody under a bus, but that's just the reality of what we're dealing with.
All right, Rena, did you want to respond quickly?
Yeah, I'd love to just follow up on that to just understand. Can you just say a little bit more? So the grant was originally for remediation of the water or the soil, which
both. It was,
and has that
yeah.
And has the water and soil remediation happened yet?
No, so the soil remediation, that's the excavation.
Okay.
That too, over time, that will reduce indoor air concentrations, not very fast, not as fast as, actively sucking vapor out from underneath the building, which
Right.
we're so
what delayed that work? I understand what delayed the air work because it wasn't all originally in the like grant scope, but what delayed, we're like 2.5 years out at least from when they got that money. So what delayed that mitigation work, which would have helped with the air quality issue as well?
Yeah, I'm kind of hard pressed to answer that, in that I got, Em and I arrived here in the scene at the beginning of the year, and it just, I have not had that conversation with the previous caseworkers, so really don't have a good answer for you.
Okay, and then I'm trying to understand one other piece, which is we all as tenants kind of got notification in summer 2021 through a notice from your office about a violation that you were trying to inform us about. But if you had the SCAP grant from earlier, since 2019, why didn't we get our notice from earlier than that? Like, I'm not understanding why I didn't know earlier.
About the indoor air quality issues?
Well, either the indoor air quality or the other issues of contamination on the site where I was working with kids.
Right. So, yeah, it's kind of I'm not an attorney. I don't really, have a good answer on why, or the requirements that the owner would have to disclose this. I'm not.
Well, I'm more asking about from like your perspective. We got a notice from the water board in 2021. I'm wondering why we didn't get any notice from the water board before. I know you weren't there, so maybe
I know
the answer. I'm just wondering what we can expect. Like what triggered that notification, given that we didn't get one earlier?
Right. So it was the indoor air data that was collected at the beginning that triggered that. Typically, when there's not a complete, what's called a complete pathway of exposure, you could have a groundwater problem, but no one's drinking the water. So, it's informative, and we should, the water board in general is doing a better job at public participation and reaching out with these fact sheets. But it's a relatively new phenomenon, unfortunately, that we're getting, the Molly Williamses of the world that's helping us with this particular presentation. We get them involved. They have translation services. They have they can mail out the fact sheets, and so we're getting there, but it's a little bit slower than should be. I think also just to circle back to your other issue about the delays and notifications, I think, this darn COVID definitely slowed down the permitting process. And, you know, I don't want to use that as an excuse for everything, but it definitely took some air out of the progress that could have been made back when this grant just came in at around 2019, and then March of 2020 hit the COVID. So
yeah, and I was just going to add a little extra onto that, because I had the privilege earlier today of communicating with the previous project manager, because I was also inquiring about that early timeline, you know, how soon were tenants notified, what was the deal. And so that indoor air data was taken, I believe, December of 2020. And then we received that report, I think it was dated the 29th of January of 2021. And then a few weeks later, the water board issued a requirement to the property owner to notify the tenants of the potential hazards of the property. And they, you know, left it at that, thinking the owner would comply. They soon found out a few months later that the owner had not complied with that. They hadn't been doing any further indoor air sampling. The tenants didn't know about the problem. So that was when they issued the violation, and everyone, I believe, was like CC'd on that. So that was kind of the early notification timeline.
So I see Lad has got some good information here in the chat. So we're aware if the landowner has provided these notices to any tenants. I am not aware, Lad. I do not know if the owner has provided those, but it would certainly.
I do know that a new tenant just moved in to the former Phoenix gym space. And I contacted them directly to make sure that the owners were in compliance, and they had been fully briefed, and they knew everything that I was already telling them. So I do know with the newer tenant that moved in, they were briefed. I don't know if any, you know, potential new tenants inquiring are being told.
Can I go now?
Yeah, really quickly, it looks like Emily in the chat said that a more recent tenant who moved in last summer was not notified.
Yeah, so I know
oh, sorry.
I was just going to say, I know the water board issued another violation for them not disclosing the contamination to the new tenant, the previous new tenant.
Okay. Go ahead, Chip.
Yeah, I'm going to say something that's going to be uncomfortable for Emma and Ron. I used to work for the state, another state agency doing cleanups. I know the situation that they are in. Emma said she's got 36 some sites, which is crazy, too much workload. If these agencies had a doubling of their budget, they might be able to do what we, the public, think that they should be doing. So that's the pressure under which they exist. And the point there is for people who are interested in this, members of the public, it's critical that you advocate for yourselves by maintaining a relationship with Emma and Ron. You pick up the phone often, you send them emails, you ask them how it's going. You tell them what's going on with you, because they've already learned an embarrassing amount, I would say, about this site from members of the public that they wouldn't have known otherwise. It's really important that you maintain that relationship, that level of communication, which only makes Emma's job and Ron's job that much more difficult because they don't have the time. But that's what you need to do for yourselves. So Amanda, you made a comment about OSHA, Cal OSHA, and I don't think I agree with that an employer is responsible for safe conditions in the workplace. It's not just the chemicals that they're using. And I haven't worked for OSHA but I can't imagine that they don't have a role or some interest here at some point. I'd like to go over one other part of the site history here, which is it used to be a bottling company originally, or way back when, and the history there would have involved enormous amounts of water in the processing operation, which would have gone to the floor drains. At times it would have overwhelmed the sewer system. And with that, and since you likely have clay pipe, which is very leaky, that means a lot of groundwater, of wastewater going to the ground. And at some point you've got a lot of washout, you've got a lot of void spaces, and you've got more area that vapors can move through the soil along the alignment of these sewer pipes. Given the age of the building, those sewer pipes have to be in very poor condition. If you do an inspection of the floor, and the water board's already seen some improvements to this, but the floor in certain spaces, tenant spaces, was in very poor condition, cracks, lots of cracks, which would allow for soil gas or vapors from contaminants, including sewer gas that's running outside of the sewer pipe to come into the indoor air spaces. And so given all of that, it is hard for me to imagine that these cracks in the floor, the condition of these sewer pipes, is not part of the pathway problem of these PCETC solvent chemicals coming into the airspace. Given what I've heard from other tenants where they describe what sounds like sewer gas smells in concentrations that are significant, like it kind of makes you gag. I think there's a city issue here too, if it's not already completely in the hands of the water board. The city has some role here to go find out the condition of those utilities and order those repairs, because I think that's part of the problem.
Okay, well, yeah, just today, Chip, was the first we've heard about sewer gas or sewer odors or anything non-PCE related to sewers. So, yeah, I guess we'll have to determine if we, if the water board is going to require some testing for sewer gas, which I guess you're talking about hydrogen sulfide, or what are we talking about?
Whatever goes in sewer gas, that's not my area of expertise, but it certainly is nauseous, if not a biohazard, and God only knows what the makeup is of sewer gas these days.
Okay, and is there a tenant space in particular we should know about?
As I can't remember the exact places. I know I think some of the flooring that I saw through the windows that was looked particularly spooky was I'm not sure, some of the corridors by the girls' garage. The tenants can tell you better. Certainly the Phoenix gym, and in some of the hallways between Phoenix gym and the restaurant. Some of the tenant spaces, I think the art supply store, if I recall, that floor had been renovated and sealed to the best I could tell, but unless I get access to the whole building space, and just as a John Doe walking around, I did not have that privilege.
No, I just didn't know if you had any inside information, but I see in the chat, Laura is reminding me of this. We had a previous conversation probably in January, February timeframe. But all right, well, we'll take a look at what can be assessed in the in that. But potentially, once there's a vacuum underneath the building, theoretically, all that air and gas should be sucked out with the PC. But yeah, I just I don't know about this sewer leakage yet until today.
Okay, and Rena, is that a legacy hand? Looks like it was. Okay. All right.
All right, now we got Peter checking in here with the water board, or the landlord has been informed by the tenant of a sewer pipe with moisture emanating from it. They sealed it, which did not work. They placed a large piece of cardboard. Oh, okay. All right, yeah, have that person contact Emma and I, please. And, you know, to pile on Chip's, you know, certainly we are open to any call, email, we will reply. It's not a burden. No bad questions, no bad statements, bring it on. You know, we're trying to help.
Yes, and it looks like Beatrice from Bahia said that there's a problem that no notice was provided to neighbors and childcare providers that are nearby. And something that we're working on is trying to improve our distribution of information about the site. So in the next couple of weeks, we'll be setting up just a simple website where you can access things like the recording of this workshop and the slides, fact sheets, right, the link to the geo tracker, maybe some simplified maps, recent screening results, all of those type of things. So we're going to be working on that, and we will let you know as soon as that's ready. All right, and the chat be made available, yes. And I'm going to put Emma's email here in the chat as well. If you have follow-up questions, I think she's been in communication with quite a few of you already. You probably already have her email. But you can follow up with her if you think of other things that you'd like to bring up. And it looks like Beatrice has an idea to have a bulletin board, right? Not everyone goes to websites. Yeah, and we are working on getting hard copy notices. So when there is the work notice for some of the soil excavation happening, we will have notices up and we will be translating those into Spanish. And if you know of other languages that are spoken in the area that would be useful to have posted, please let us know.
And yeah, clearly there was a communication issue between the owner and the tenants at this property that we're going to work to rectify. I don't know that we could ever, you know, rehabilitate that, but that seems to be a common theme through our discussion. So yeah, let's see what we can do to bring that up.
Okay, any other questions out there? All right, seeing none, slowing down here. All right, so we'll go ahead and close out. And again, we'll be in touch about next steps and any updates going forward. And would any other state representatives like to sign off with some closing words?
I just want to thank everyone for taking time out of their evening. I know 7:30, you know, can be late and people, I'm sure, have other things to do as well. So we really appreciate everyone taking the time to gather. And we love receiving feedback. I mean, negative or positive, you know, I'm new-ish to the water board. You know, I'm still learning about, you know, how we can be better at public participation. So if anyone has any sort of commentary on that, my email inbox is open. I respond, you know, most times of the day and night, even on weekends. So don't be afraid to shoot me an email.
We're all good.
All right, well, thank you again, everyone, so much for being here tonight. We really appreciate your time. Your input is very valuable to us, and we will be in touch soon.
All right.
Wait, I'm sorry. One second. There's somebody in the chat who's saying that they would like a response to their question.
Oh, I'm sorry. Yeah, who's that? Hey, let me roll up here.
EH.
Oh, here we go. Thank you. Here at 1370B, we're missing for the last 4 months between December and March.
There was sampling done in the most recent April sampling data that I went over in 1370A and I believe B. I'm pretty sure I put the link to that in the chat towards the top, that you can refer to the data for that.
And I guess in general, and I'm going to just say the contractor goes out there. Again, I don't believe there's been great communication with the tenants saying we're coming out on March 14th or whatever it is to collect your samples. It seems like it'd been more of a, they show up and walk throughout the facility to set up their devices. So I think, again, this communication issue rears its head again. Perhaps no one was at those tenant spaces to deploy the samplers. I'm speculating now because I don't know why that was not included in December, January, or February. So, or March for that matter. So is this an operation is someone there, not all the time, but regularly? I'm not. Oh, here. I largely. Oh, okay. Then, yeah, I don't have, again, unless there was a reason to not sample it because the air was clean the whole time, which I'm not suspecting the case. We'll make up for that, try and make up to that going forward by collecting the data.
Okay, great. Sorry for missing that earlier. All right. So assuming we have covered everyone's questions, and again, feel free to reach out to Emma with any questions and I'll get back to you. All right, everyone. Don't want to keep you from dinner any longer. All right, thank you, everyone. Have a wonderful night. We'll be in touch.